Hello, my name is Mike G. My son Seamus, he passed away at 16 years old. He was a great kid, full of energy, full of life. Seamus was multifaceted in the sense that he was very caring and compassionate, and he'd go out of his way to help others. Um, in the week prior to when he passed away, it was a pretty big week for Seamus. We talked about his future because he was starting a specialized trades program because he wanted to become a carpenter. He was starting that in a couple months, so we were getting ready for that. And then also 4 days before he passed, it was his 16th birthday. And like most 16-year-olds, he wanted to get his license right away. So we actually did that a couple of days later, which was 2 days before he had passed away. And he's really excited about that. Even the day of his passing, we had plans that afternoon to be going for a drive so he can get some more experience, and he was excited about that. There really wasn't any signs of any issues. He was a typical teenager, trying to push the limits here and there, but we were working on that and dealing with those things. But there wasn't anything, any real signs that something like this was coming. Since Seamus passed away, my life has obviously changed immensely. It's empty, a sense of emptiness. There's definitely a big void. Seamus was my best friend. And just questions about the untapped potential he had. I think the biggest way that Foundry would be able to help teens in the community is for them to have a place to feel comfortable to go to and not have to wait for months for a referral to get the help that they need. I know several people who've had to deal with that, and then people fall through the cracks. Or if they can get the help immediately, that's going to benefit everybody in the long run. If it can prevent one other parent from going through what I've had to go through, it'll be worth it.
I'm Geeta Gupta, and I'm a family physician working in Langley. Amongst all the patients I have, I think I have a special soft spot for all the young people that come to my practice. Langley is growing, and so is the population of young people in Langley. A lot of them also struggle with mental health issues, and that's when they reach out and they want some help. They struggle with your relationships at school, struggle with relationships at home. That's when mental health issues crop up. So it's known that most mental health issues come up in their teens, and if they are identified early, then they can be corrected, they can be nurtured, and they grow up to be healthy individuals. But if those symptoms are not identified and they progress, then they'll have a lot to deal with as they grow up. They need a safe place to connect and form relationships with their caregivers. In primary care, that is difficult, and the youth themselves feel a little restricted in divulging their personal and emotional issues with your family doctor sometimes. They need to have easy access and a walk-in setup for their healthcare needs. I mean, it's difficult to get youth to come to you and ask for help, and when they do and they don't get it, they won't return. The Foundry in Langley would be a great asset. Our youth would grow by leaps and bounds. They would have their health issues would be easily met, and they don't have to knock on 10 doors to get any help that they do now. They just reach out to one person, and the navigator in the site will get them through to all the resources that's available for them. We need these issues to be seen and supported and nurtured so that they grow up to be healthy adults and contribute to our society. Youth is our future, and Foundry is our go-to.